Okay, cool. Okay, so welcome to the PAC's latest podcast, Monday, October 26th, 2020. I'm Tristan, here with my co-hosts Nick and Lawrence, and we're welcoming Mike back to our series for the first time in a while. We did have you on once before.
Hello, Mike.
We started.
Hello.
Now we've brought you on board to talk about something very specific, but I think it's very pertinent to the current climate. So we spoke a few weeks ago about a month or a bit ago, I think, about the whole difficulty people have currently getting any kind of diagnosis of anything because of the COVID situation, because of how it's sort of the NHS is sort of so fixated on that, for better or worse. Now, of course, objectively, I know that it's a situation where everyone's this new thing, the pandemic, everyone's scared, and obviously the system is perhaps overcompensating, and I think that may be a big part of it. It's the fear, that's what I'm beginning to sense. And obviously the trouble with that is that people who have other difficulties can't get the help they need. I mean, just as an aside, I've not been able to see my GP for months. It's probably the same for most of you guys. Not see my dentist. You can't get a dental checkup. You have to have actual serious problem first, which is ridiculous.
Hey, that's why my teeth are so fucked at the moment.
But that's really not. But that's not natural. It's not healthy. I mean, and obviously I spoke to you about this, but so your girlfriend Julia, we'd like to give us a bit of background on this whole thing, and we can take it from there.
Yeah, of course. So what I was saying, effectively, so my girlfriend, she sort of had long-standing issues with depression and stuff like this, and we've worked through it a lot together, and also for me, I mean, I have issues myself with which I was diagnosed with quite a few years ago with dyspraxia and ADHD, but there's not really something that's really massively affected me in regard to, it affects me a lot when I was studying, because I just didn't focus a lot, very all over the place. And but now when I live in my own way, it it has some issues, but for her, it's sort of like together, like there was a lot of things coming up, and we were realizing, and she's sort of after she studied psychology, so basically during that time she was looking into stuff very intensely, like stuff around mental health, stuff around and during that time, like obviously having this long-standing stuff with depression and not really having any clarity around what it's all about, sort of realizing that there's something that's not feeling connected with, say, everyone else in regard to like social things, and in regard to just everything is always like a bit not fitting in at all, basically. And then, she's written the experience, obviously, so I don't want to go into too much detail about that, but just sort of the main thing is that the main issue that I've noticed is that there's a very, very long process that you go through anyway, even when it's not this period, with this COVID situation where obviously everything's sort of shut down. Even like I found out today, I had this issue with I cut my finger open, had this surgery, but it's only a couple of weeks that it's been open to go and like have like face-to-face stuff going on with this sort of thing. But obviously with this sort of thing, you need obviously emergency stuff, but it's like they've closed a lot of, like everything had become sort of either online or just like minimal face-to-face contact, which obviously I can understand is important, but when you've got these, there's these other things that are happening that are very serious, like, people having big, like long-standing issues, and they're not getting any support for it. So for example, with the situation with my girlfriend, it's like she was just on the cusp of getting sort of like a diagnosis around this situation, with the autism, because she's very clear that that's what it is, and it's done a lot of research into it, like for like almost a year really, and like very thorough research, and then it was basically just about to go through to do like this assessment, and then it just was like you have to wait until after COVID, effectively, which is quite a big thing to take on, because it's like that means it could be, I don't know how long it's going to be,
that's indefinite. It's not a helpful time frame to be given, is it?
Exactly. It's sort of like there's no real knowledge of when it's going to ease up, and it's so it's really difficult, but the main thing is I mean from my perspective, it's just been trying to just like, there are times it gets really, can get really tough when you get, especially as I'm sure we all experience with different, if you with mental health issues and stuff, it can get really like to a point where it's like like a breaking point. And then it's like, it's really important up from my perspective. If I'm in a better position, if I feel like I'm okay, then trying to be caring and compassionate, because it can be really, it's sort of really difficult. But then on the other perspective, sometimes I get into that state as well. And it's, if you're in that situation where, say, with my partner, if we're both in a really bad state, it's really dangerous sort of territory. So but just trying to find ways to deal with it. Sorry, just to say, like,
no, it's good.
Carry on.
Yeah, just to say, it's like what one very positive factor that's come out of it is like learning to deal with everything like on your own, like knowing that actually you have the capacity, or feeling like, learning that you can get through those moments, and actually there are ways that we're maybe designed to be able to, get through it in a sense without the support of not we need other people to support, but I mean, like, we're basically forced to learn for ourselves. You know what I mean?
This is really interesting.
Yeah.
I was going to say this is really cool, because what you're actually talking about is less specific and more about, less specific in the sense of an actual a thing like we can be diagnosed with, but more specific in terms of, like you're saying, like those moments everyone has, but especially people who have specific mental health struggles. They'll get you get to a certain point, but they'll be sort of like, so you're saying basically that, like, you think everyone's got that inner strength, they can sort of rise above it, or they can find a way to. Is that kind of what you're saying? You think at some level?
Yeah, I mean, I think that I do believe that, actually. I do believe that is.
And me.
I have that, but I also know, I believe that we have that potential, but I also know that there is that sort of, it's a fragile area, because there is that point where you do need, sometimes it can be like that little bit of support can actually really go miles, and really sort of actually get you out of that place where you're at. But I do think that at the end of the day, it is we're just with ourselves in the, and it will, like we can, but also because of the situation, because we haven't got that support maybe from, say, the NHS or like things that are around us that would usually be there to support a bit more. It means that we, maybe we have to do, like, I've been doing a lot more deeper research than I would have done when I've just been going through the motions of, I mean, not to say I go through the motions outside of this time, but I feel like this time has made me just go like, what the fuck is going on? We're feeling really like it's really surreal. So like, also recently had this, which is a slight different topic, but like been researching a lot into everything around social media and like sort of the way that it just sort of controls us and gets into this position where we feel, in a sense, that sorry, what was I saying? That not controls us, sorry, but there's like a supercomputer basically that sort of manages like all the sort of advertisements and what you receive in your feeds and that sort of stuff. And once
you're one tiny number in the algorithm, and it's the internet knows what you probably would like to buy, because it's documented every one of your internet searches on Google, your Amazon.
That's what cookies are on Google. If you go to a website and they ask you, do you accept or reject these cookies? Cookies are there to keep track of all these things, and I tend to reject them these days for that reason. I don't want that information.
I think you make a very interesting point, and that how mental health issues and loneliness are so interwoven, right?
Yeah.
And it just so happens right now we're being told to isolate, and the NHS services aren't, moving as efficiently. There's not as much support out there for people. So for people with mental health issues that are very difficult, they're having maybe to rely on themselves more than they had to before.
On their friends. Yeah, I mean, this is the one thing. My experience, in fact, I've wanted to extend my personal gratitude to these guys, my close friends who have really been supportive of me in this time, and vice versa. I've tried to support other people as well in that regard as best I can. But it's really interesting how you sort of naturally, Mike, conflated sort of the media and the whole COVID thing, because unfortunately, I think we just don't know what information is accurate or reliable, because information can be so easily like sort of, it can be misleading, and you don't always know who to trust and what sources to trust is really kind of what I'm saying, and that's very frustrating. So I completely get where you're coming from. I was going to ask you on that note, have you had a lot of your own struggles with the lockdown, and well, not really lockdown now, but just the whole sort of general thing with your mental health?
Yeah, I mean, main thing is that with the sort of, to be honest, it's improved quite a lot since moving to Brighton. Like when we spoke last in April, that was like actually a really difficult time because we were living in a room that was basically, so we for actually quite a long period of time, we were effectively isolating in this room. And there was sort of, I can get quite, one of the things that, I mean, it sort of, can get quite aggressive, not like, in a physical way, but just sort of really like a lot of energy comes out in bursts. That's one of the things with the ADHD. So it's sort of, but it's this thing where, and I need to do things. And what I learned was that it was good for me to, like, I started to go for a run. Like when I just had that energy, I'd just run.
Oh yeah. Facebook. When didn't you put things on Facebook?
That was around that time actually. I was just like, went for a run and it would just let out all this energy, and it sort of would be like I was almost like, I always felt like almost like a different person after.
I did the same thing, man. It's really liberating, isn't it?
Yeah.
You just run. You don't have to have any target. You don't have to have any intention other than just running, man. Yeah. That's also the thing that was like exactly that. Sort of it could be like 5 minutes, it could be like 20 minutes. It did exactly that. It doesn't matter, and it's not for any, because all the reasons why I always ever stopped doing anything like that is because I always felt like I've got to do this like by this amount of time, and I've got to try and achieve this. That's it. You put like a framework around it. Yeah. But that can be useful as well, because you might get the benefits from that that are different,
Yeah.
No, I think that's a good thing to do, like, because I have ADHD too, and that's why I play drums a lot. I think, like, growing up, I was always tapping on a table.
Yeah.
Like, if you have these little random bursts of energy, like, you can do something productive with it.
Yeah.
And that's the thing which comes back down to mental health, I think, is if you have the outlet for that energy,
completely.
and you can use it in that way.
Yeah. I mean, this is something I'm going to start doing, more physical exercise. I found also mental exercise, like for me, writing, doing music really helps. Or writing, obviously I'm a writer, so writing short stories, anything like that, really is really helpful.
Okay, you have to come to terms with who you are as a person in your own head.
Yeah.
And once you understand that, then it makes it easier. And I can explain this in a Buddhist term, actually. Buddha said, life is suffering. Once you realise life is suffering, life is no longer suffering. And what he meant by that is life is hard and life has its problems. But once you realise that's what life is, and you have the joy, the understanding of life, and the ability.
I think that's beautiful. Yeah.
Yeah, I mean, with Nichiren Buddhism, which myself and Mike practice, it's the same thing, really. It's the teaching is that, I think that a lot of the time is that life is a challenge, and if you just accept that daily life is full of challenges, instead of being scared of it, you just deal with it and keep going. It's really hard, but I mean, maybe that's the way to look at what happened today. I had a little bit of trouble with stuff, partially because of my own difficulties with time management and my sleep issues, right? And if I recognise that and I accept that I need to change that and work on that, then it's like, as it goes on, those difficulties will reduce, and I'll have other difficulties, obviously, because people do. But it's a key part of all Buddhism, isn't it? That you have to it's being strong in yourself that matters most, and which is really hard. So I think we'll move on to the your girlfriend's. Well, it's basically like an experience, isn't it? So like, would you like me to read some of it out then, Mike, or how do you feel about that? What would you like me to do? This is obviously.
Whatever's that's fine. If you want to read some of it out, or you can even summarize. Yeah, whatever's literally, she's fine with whatever. So maybe read it out.
Well, I mean, I might just summarize it. I mean, basically, it's like what you said was that she basically she's felt for a very long time. Perhaps maybe I mean, I don't know how long, but was it since that? Well, yeah, has it been since maybe many years she's felt disconnected from certain things?
Since she's ever, basically, since she was a kid.
Yeah. Okay. So, I mean, she's talking here about how she wanted to experience freedom, that's why she moved to London, and then she studied psychology, when started practicing Nichiren Buddhism, which is how you guys met, I assume.
Yeah.
Which is great. And then she read about a lot of different things. So borderline disorder, bipolarism, and autism. And it's interesting because, yes, this is great what she said here. She said, because in my sincere opinion, there's no such thing as disordered. A personality is not a disordered personality. It is solely a unique personality with its own struggles. Yeah. But what she's saying there is people shouldn't be, in any way, no one should be made to feel they're wrong for having a disorder. But it's more like what I always say, that so-called disorders are really just differences in how you look at it.
I think about knowing where your strengths and weaknesses are.
A lot of it is, yeah.
So Julia, essentially, as a young kid growing up, felt disassociated with other people surrounding her. And as she got older, she wanted to experience what she called freedom, and she went to London, went to university, and started studying psychology. And in part of that psychology, she discovered bipolar studies and autism and that, and realised that actually some of these traits that were being mentioned were similar to how she felt as a child growing up. Yeah, so she found these studies on bipolar and autism, and realised that some of those traits that she had experienced in her youth and growing up, and she self-diagnosed herself and realised that actually, no, some of these things really ring true to me. And although, as far as I can gather from the piece, she's still waiting for a proper medical diagnosis, even though they've been giving her tablets, which she's taking because she obviously wants some sort of respite from the torment, but she doesn't know whether it's a good thing.
Exactly.
But she has found some sort of solace in Buddhism, which is good. Out of all the religions, I think Buddhism is probably the best.
Yeah, I like it.
How long have you been with the mic?
Since 2017, beginning of 2017.
Oh, okay, well, brilliant.
Oh,
yeah,
congratulations.
Yeah.
Thank you. Yeah.
And it's still, it's going all right at the moment. Still, is it? You guys?
Yeah, it's been really powerful experience overall. I mean, in 2018 we had like a big it was actually when all this was going on, this main thing, where this is where it all came out, because we had like a big effectively well, it was actually me at that time had basically a breakdown, and I moved back to Brighton for 6 months when we broke up at that time. But it was actually what I had to learn a lot about myself through that time, and actually a lot of stuff came out through that. I did a lot of therapy and counselling, and then we got back together, and since then it's been really, like a lot stronger. Obviously there's ups and downs with everything.
Yeah.
But then now in Brighton, but the next step actually, there's like, I feel like we're strong together now, like than probably we have ever been. But now she's really not feeling happy in the UK at all, and she wants to move back to Italy. So she's moving back home in 2 months, and I have this thing where I need to make a decision if I'm going to move to Italy as well, which I do want to, but just not right now, because I feel like with it just doesn't feel like the right time. So, so basically the situation's going to be December the 11th. She's flying to Italy, back to Florence to live with her sort of family, and so just her mum actually, because she lost the rest of her family, but she just moved back with her mum, and
right.
Yeah, that's
so that's a kind of a big uncertain thing for you as well, isn't it? Because you don't have to move over there, and you wouldn't have a job actually to have an income in, and you have to do something, and it'd be a completely different environment. So fucking hell, you have to be going through it.
What I want to do is I'm going to quote just the end of the experience. I think this is the most important part, because she talks about she says, I continue to read about autism, this time by people that are actually autistic, and I felt like someone actually thinks like I do. I started to follow people on Instagram who share their experiences. This is what doesn't make me feel alone. I should be saying, makes me feel less alone. She says, I've always lived in my own world. I can't always express how I feel, and I can't always communicate what I really want to say. I prefer to write it down. I have more time to think what I actually want to say, and it comes more natural. Actually, there are a lot of valuable characteristics. I'm glad to be autistic, even if not professionally diagnosed. And she ends by saying, because I moved a few times in London and recently to Brighton, I tried to get referred again to get an autism diagnosis. This is the crucial point. They said to go back when COVID-19 eases, but she said I wasn't sure what that meant. Is it when COVID-19 finishes? Because that's pretty ambiguous, isn't it, as we know? And she said, anyway, I couldn't find anything back. I just thanked him and said, okay. And that must have been the doctor she spoke to. Is that correct, Mike?
The doctor, yeah, in Brighton, yeah, because it was.
Is he a specialist in autism, or was he just some ordinary doctor?
So she had already been referred through to the next step, you could say, to then go on to have and then we moved. So when we spoke in. So basically, she spoke to her in you could say, because I see it like there's almost been like two sort of lockdown. There was a lockdown at the beginning, and that was like the time where in London they said, "All right, you need to wait." And then when we moved back here, because it eased, like we felt. I mean, she asked again, and it's the same thing. Basically, exactly the same thing. Just saying, wait until like COVID's like the centre of everything now, so you need to wait until after that, and then.
Well,
so that sort of just. Yeah, I think it made her a little disheartened at first, but then her research has just gone like even much.
Yeah, that's great. I mean, to be honest, that's not the thing. Is a lot of the so-called professionals, that being funny, but a lot of the time they don't. I mean, they do. I mean, on a higher level, they probably do know what they're talking about, but at the same time, they're just labels, and these are just people, right? Just like us, so they can't get things right. And in the end, I think it is down to the person's own experience, and if anything. That doesn't make it okay what's happened, but it's good at least that she's taking the lead and finding her own sort of research about it. You know what I mean?
I think that's quite empowering, really, because psychology is ever evolving. We don't by no means have it all figured out.
No, we don't.
So doing your own research is probably the best thing you can do.
Well, I mean, for example, we still don't know. I don't know how much is known about this.
Given the circumstances.
Well, the extent to which, something I've always wondered about is the extent to which different mental health. I don't know, differences or whatever can sort of overlap. But I don't know. I think it's possible to have bipolar and autism. It's also possible to have. Obviously, it's possible to have ADHD and autism. There's a lot of things. So I think it's really good she's doing her own research. But I guess the key point is that she wants to talk to professionals, and she finds it very difficult because of the current situation. Now, what we want to do is to raise awareness of this, which is what we were doing with this, and which is why we're going to release this. And we want to make this into a thing. We want people to hear about this, and obviously this is the whole reason we're doing it. So we'll do everything we can to raise as much awareness as possible through all these videos. So that's our main focus. I think it's really important. Mental health is really important to us, and I think through the arts as well. That's the big part of it, as you know. Those are the main questions, the main points. But so what do you think about the whole thing as regards to the way the NHS handles all this? I mean, this is one of the biggest questions. Do you think they are dealing with things appropriately, or are they making mistakes? Because I mean, obviously, there's already known there's people who have cancer who died because they couldn't get help because of the whole, because it's something to do with COVID. So I don't know. My views are that I think it's not really working that well. But I'm curious to know what you think from what you've experienced.
Yeah, I mean. Just from experience of, I suppose, just the recent event with my finger being, having this issue and then going in and sort of, I think there's one thing that I really, that's really difficult about it, I feel, is just the way that it makes people feel like the sort of anxiety that people feel specifically, and even makes me feel even though I don't want to, in a hospital setting, a hospital in a. So I do sort of feel for the workers there, because I can see that it's just barrage after barrage of just
everything,
just anxiety permanently, basically.
Yeah.
From everyone. The other thing is I came in had one experience which was, so I had this surgery, and it was straight after the surgery I didn't initially get put on any painkillers, so. It was something that they had actually missed out. They forgot to do that bit, and I just thought it'll be fine. It's just they've healed it. And I didn't think, obviously, after you have a surgery like that, it's really painful. For the first few days afterwards, because it's everything, all the tendons, the nerves are healing, and all fresh, and it's still. So I had all the thing on, and I was just really in agony. So I So I just thought I need to go. Like, I called up and I said, like, this pain is just like insane. I don't know what to do. And I was like, sort of just consistently in agony. And then they said, just go to A&E and get it checked out. So I went to A&E and I was there for like, it was a Friday night. So there was like, people with all sorts of stuff going on.
Yeah,
so I was there, but the only way that I ended up getting seen, which I don't want to blame them, because it was definitely, they were really overrun. But I just basically had what was almost a panic attack to get any attention. And that had to wear, everyone obviously has to wear the mask no matter what your situation. So one of the things that's really, because I have panic attacks as well, like that's one of the things that can happen, I was sort of in this state where it was like, I kept having to take the mask down because I was like, I need to breathe. Like, I need to breathe, because otherwise I'm going to just go into a full blown panic attack. But then at the same time, obviously I need to keep the mask on, because they kept saying, can you have the mask? And then I just started basically screaming and shouting, which I sort of regret, but it got them to get me from.
They got the job done.
Yeah, got the job done. Went in, they gave me tramadol straight, and it just, got the job done. But it just, I just sensed, and I sense it every time I've been in, like, just to sit there in the waiting room, and no one wants to look at each other, either, because it's just like, there's just this feeling that's been created where it's like just this anxiety, and I think that's really bad. That's the most damaging thing. Even though COVID's obviously really serious, but I think that's for me even more damaging. Like the fact that it's like already we're quite isolationist sort of society.
Yeah.
100 times more.
I remember I saw a sign at a park that said COVID-19, act like you have it. Yeah. I just thought that was kind of instilling the wrong message.
It depends how old
we're
you
being
are,
taught
though,
to not trust each other. We're being taught to not trust ourselves.
Yeah.
It's like, I really relate to everything you just said, Mike. Thank you for that. I mean, especially the whole sort of when you got really frustrated, and because I do that as well. I get very frustrated by my own problems. I think having to deal with that in a medical situation, I've been lucky. I haven't had to go to hospital for a while, so I know it's all a bit mad, because I think the trouble is, of course, to be objective, we have to understand there is a problem, and there is, the people have died from something that they're calling COVID. There is something going on. There is a virus that is dangerous, but at the same time, I think just taking what the experts say on board without questioning it isn't always wise. It's good to look at everything from a broader perspective, which is the reason we're doing these podcasts as well, to really broaden our understanding of the whole thing. And it's very clear that it's not right for the system to be focused so much on one problem that they forget about everything else. And my viewpoint, no matter how dangerous it is, you can't fail to acknowledge other problems. I'll give a quick experience about this though, because my mum's made sure that I have a couple of layers of protection. For example, I've got a letter from my GP, and I've got like a card as well, which is basically to do with like emergency services and stuff. So basically what it means is that if I'm in a situation where I should have to wear a mask, and if it's too much for me, I can get out of that if it's too much for me, because I've got these things. There are ways to overcome that, and they allow exceptions to people with, if they're fully diagnosed and they have a mental health difference or problem. So, for example, I can still see my therapist in person, as can I think other people with autism. Not everyone can. So if you have the right knowledge of how to use that, it can be quite effective and a way to.
Do you have to wear a mask when you see her?
No, I don't. It's up to me. Up to her. If she asked me to, I would, of course. That's the thing. That's how it should be done. I think that's the best way. You're allowing people to individually decide. That's what
there's common decency, and that's
it.
Like individual responsibility.
That's it. It's not. But because the thing is, if you go around assuming all the time that you have something that's really dangerous when you may never have it, it's really destructive. I think that in some ways is much worse.
You could say that about AIDS or any sexually transmitted disease, couldn't you? Really?
Yeah.
Well, I haven't had a test, it's I think you do have to err on the cautious.
Obviously, there's not throwing caution to the wind, but they're like, I don't know. The thing that interests me is that I was talking to my mum the other day. She's a doctor, and she said we had like 70 COVID-related deaths one day, and it was in the news as, oh, this is alarming. But that day there'd been 500 deaths from the flu.
Normal flu.
Yeah, and like that hadn't been put in the news. And I don't know, I think there's proportional response to, you know, certain situations, and I'm not sure that we've got the proportions right now for COVID.
I don't think we have.
Because if you look at like every other health issue, they're still there. Mental health issues still there. COVID didn't stop those.
That's right.
You know, cancer, surgeries, heart transplants, all these things. It's as if the light is firmly on COVID, and you know, they put everything else on the back burner.
That's right. And this is exactly what this is all about. And I think obviously, like, yeah, it's just really challenging. But but everything you said, Mike, I completely get that. It makes a lot of sense to me as well. So thank you for sharing that. I think obviously it's like the issue is that there is no black and white answer. But I think the key is to basically raise awareness of the fact that you can. It's good to err on the side of caution if you think you might have it. I think the assumption that everyone's carrying it all the time is itself also quite negative, though, because I think that's bullshit, because there's no way we're all carrying it, because otherwise it's everywhere, in which case we may as well just, just continue anyway. It's like, it's not that. It's more like some people have it and then some people catch it, they don't pass it on. It's so confusing, and all the information about it is so convoluted. So it's really hard. So I really sympathise with Mike. So yeah, it's hard, really hard. So I mean, those are the main points really. So, but that's really good, and thank you for sharing that. How do you feel like? What are your general thoughts on the whole thing, on the pandemic? I mean, because obviously, like you said, the media has said a lot of different things. That's that last main question. Then we can just discuss it freely. But how do you feel about the whole thing generally?
So I mean, I would say I feel like as I just mentioned then about what it's creating among, it's like the human to human bonds that I think, like for me, like is the most I've found is like the most valuable thing is or like I miss so heavily is like face-to-face contact with people in general, like meeting people, meeting up, and obviously events and stuff, like going to gigs or like just having a chat with someone. And
because a year ago you would have taken it for granted, right? Just the fact that you could go a place with as many people who were there as possible, as they could fit in there. It didn't matter.
Exactly.
I miss those days.
It's like
waiting for 20 minutes at a bar to get served.
I miss the drinks, man.
We had that. They have to do. We went to have our meeting there. We have to like order everything on our phones, didn't we? Which is I get what they're doing it, but I guess that's their way of erring on the side of caution, because they can't prove we haven't got something. It's easy to do it that way. But yeah, go on, Mike. You were saying about like.
I mean, just that's that's sort of a positive thing, is that after, hopefully when it sort of blows over, then it will be like having a lot more gratitude for that
really taking appreciation of the liberties we had before. Exactly. And I mean, and I think that it's also like you were saying, Tristan, as well, about the confusion around everything. It's difficult because it's sort of like also like the things around the symptoms like are so broad that it's sort of like you can cough from multiple reasons. You could be coughing because you smoke, you could be coughing because you're really like cold a lot of the time or something, and you got flu, like you got some other thing. But then obviously you just start to think immediately, like actually I ordered, because Julia like has been coughing, so we decided, I need to get the thing. But then I've actually got the test, but then I realised I don't want to, like when I went today for this, it said on the sheet, which in the end they didn't question me about it, but if I'd said, listen, I've ordered this test, I should have been staying at home, which is like, because it's just a thing. But she also smokes a lot, so it's like I think, well, maybe it's difficult to know, like until there's
literally that whole thing could just be paranoia. For what I mean? In this case, like you guys could both be fine. They're just you're concerned, and they're assuming because they
it's just such a mind fuck. Basically, it's just really doing my head. So
yeah, and I understand.
It's a year of the mind fuck, man.
yeah.
And there's another example of that. We were saying last night, Lawrence, we were talking to Chris on the video forum, and we were talking about the environment and how that's a big concern. And obviously, that's also probably not being a bit neglected right now, because again, if you focus on one thing, it can sort of remove everything else as being anything seen as important, and that's the point. It's like, well, I think I'm sure when there was a Spanish flu thing in 1918? I'm sure it wasn't handled this way. It was done. It would have been handled very differently. But maybe they were not careful enough then. But now it's like we're overcompensating. In what I can tell, it doesn't mean it's not dangerous. I think my way of looking at it is you just isolate the people who are really vulnerable, and everyone else. If you think you're getting ill, then get a test. Whatever. Other than that, just continue. I think, but that's just my view. I know not everyone's going to share that. So it's just like
sure. Well, it's like, before COVID, viruses existed. There was a common understanding to, not, pass illnesses on, purposefully. If you were ill, you'd stay away from your loved ones,
That's it.
There's a common sense that we should trust in humanity. Not everyone has it, but, where would we be if we couldn't trust ourselves?
Yeah, but actually, the government all the authorities have to, just nanny us, basically. Tell us exactly
I think at the beginning, a lockdown kind of worked because, NHS was overrun and they needed people to stop getting infected.
Because the older people getting very ill, that's right.
Yeah, and there was a huge influx,
Yeah, that's right.
So it made sense then, but I think now they're kind of petering around the issue with doing little things like closing the pub an hour early. I mean,
we managed to do our event. To be fair, we managed to do our event a couple of weeks ago, and we did it all outside.
Yeah,
doing things outdoors is a safer way to do it as well. I mean, that's what we managed to do. And it's next time we do one, Mike, I hope you can come down. That'd be cool.
I'm just glad we got live music out there again, man. It's been so long. You know what I mean? So
it's crazy. Yeah,
that's brilliant. We covered all the main points, and I think I'll just conclude by saying that, this is really good for us to get these broader perspectives and to really help everyone to see that mental health is not less important than physical health. They're both equally important, I think, actually.
Yep.
And I think the more that people are aware of that, the more we can raise that awareness, the more we can push that people who are in the system will see this and they'll recognise it's not just about this one thing they're seeing. It's the whole bigger picture. They have to think about everyone and not just people who are not just this one thing that's going on right now. So thank you very much, Mike. That was really excellent. Thank you.
No worries.
Thanks, Mike. Cheers.
Absolute pleasure, mate.
So,
enjoy your food.
Thank you. Take care, guys. See you soon.
Have a nice nibble. Cheers, mate.
Bye.
Cheers.